while back, I made a video regarding acute low back pain or somebody that has a low back injury. I think the whole point of it was to always work around pain and don't let it sideline you from doing the things that you want to do. In this video, what I want to go over are just some exercises that I might start to work in for somebody that has low back pain. To engage or be active during these episodes, what that does is it's going to build resilience, it's going to build confidence, it's going to get people feeling like they can overcome it. And that is so key, especially for people that deal with chronic pain issues and might have some kind of psychological or mental health issue on the side, like anxiety or depression. First thing I'm going to do is I'm going to go on the back. I'm going to have somebody go on their back. From there, we can do a little bit of what we call a curl up. So here, and I lift up, and then I come back down, just like that. So I might lift up and hold. In these positions, I can work on leg movement. A lot of times, this will not be painful because they've got so much engagement here. They're driving their lower back down here that they're working around the painful sticky points. Start to go the opposite way with the legs, where we're gonna start with the legs up and then to here and just move legs. We can transition into a dead bug, alternating arms, same side arm, leg, really doesn't matter. The point is, when people start to feel pain, my cues are, well, flatten your back. So get in a better position here. Double down on some stiffness here, whether you need to breathe in or you need to just create more tightness there. And then what you'll find, a lot of times people will see that their pain goes from a higher number to a much lower number. We're not always looking for zero pain. If it's a 1 or 2 and people can tolerate it, to me, that's a green light to keep pushing through. Second thing I'm gonna do, maybe we exercise them a little bit on their back, we roll to the side, okay? And we do just the side bridge. And what that's gonna look like is same concepts. I wanna get out of extension. Usually I find extension tends to be, from an active standpoint, triggering for a lot of these situations. So here, and then we just bridge up. And I'm just working on holding and breathing. Okay, so if we find that it's painful in certain positions, we then work on modifying positions. So if I'm here and then I start to see a lot of like extension there, that might start to hurt, I'll double people down to here, maybe breathe in a bit to work around the pain. Lastly, something simple that we might try are some type of exercise ball plank and or rollout. Now we're adding movement, so it's really important that people start to figure out how to position themselves when they start to feel pain, and it's a good practice moment using the ball. Here, position. So even here, we can work on cat-cow, cat-camel type approach. People will find they got pain in certain areas, we just work with it. Start there, breathe in, and I'm just gonna roll out. Now the key is that I can maintain a good position between ribs and pelvis, and I can hold. I can just hold and breathe. I always love to force breathing into an active core. So again, work out of extension, stay here. I can do rollouts. I can roll out and hold. I can roll out and hold, and then do a stir the pot type of drill where I'm just circling the arms. The key here is, so a lot of people will do this and their whole body moves around, and I guess that's fine, but what I try to do is keep my trunk tight, keep it still, and I'm just moving the arms, whether I'm going in circles, forward and back. So more of an exercise ball approach with rollouts and planks. Next time you have low back pain, try to do actual exercises. In these cases, I am targeting more of the abs and the obliques, challenging stability with movement, trying to maintain the position between our ribs and our pelvis. Big teaching moments, whether it's yourself or we're working with a patient, is that when they start to feel pain, traditionally people stop or they think I shouldn't do that. Well, really what we want you to think about is, how can I do this differently? So we go over simple cues. It could be something like, hey, push your back down, or try to get more parallel between the ribs and the pelvis. It could be just consciously create more pressure or stiffness in your core, whether it's a intra-abdominal pressure with a breath in or just a brace, whatever you need to do to take the threat level down. At the same time, we're going to go over different strategies regarding pain, something like, obviously if it hurts, don't do it. We're not abiding by that approach. Knowing when to push into it and when to pull back. Hope this stuff is helpful. This is probably the more common thing that I'm ever going to see in a day as a chiropractor. There are more solutions than to just adjust people. Those are good tools as well. But the key is to keep it moving.